Hi, we're here with Dr. Michael Messmer. He is the medical director for Beacon Health and Fitness. Dr. Messmer, thanks for joining us today.
Thanks for having me.
Not a problem. So our locations, Beacon Health and Fitness in South Bend, Granger, and Mishawaka will be reopening on Tuesday. A lot of people
Yep.
are excited about this. Can you outline some of the changes that will, temporary changes, I should mention, that will be occurring? Because like any business that's reopening right now, there are changes being implemented.
Yeah. Thanks to this COVID pandemic, we are trying our best to make ourselves available to the public and get people back into their normal routines. But as with everywhere else, we're going to have to be following some guidelines that will hopefully be changing over time, but that we're going to need to just be doing. And the three main medically backed guidelines that we're doing. Is really there's three ones that I want to talk about. The first one is wiping down the equipment. As before, this was something that we recommended to people on a regular basis to help kind of keep things clean. This is going to be a requirement now, and we're going to have some people walking around making sure that that's done, because just in order to prevent droplets from spreading, and the things that you touch from spreading, it's just important that we use those sanitizing wipes and sprays to keep things clean. So it's just something that I think will help prevent the spread of this further. Also with water, right now, the governor has actually recommended that we bring our own water bottles to these things, and I agree with him 100%. It's really to eliminate multiple touch points. When we use our water fountains, that's a lot of people touching that area. That's a mouth to water fountain kind of area that just increases the chance of transmission of viruses in general, let alone COVID. So we want to make sure that we're preventing that from occurring. So there won't be any water fountains running, and we encourage everybody to bring their own water bottles for that. The third one and the final one I think that I wanted to talk about is probably the one that everyone seems to be the most controversial right now, and that's wearing your face mask when you're exercising. This is a tough one, and I feel for everyone out there. I exercise as well, and this is not a fun one to do. And certainly there are some things that people are not going to like as a result of this, but there's two main reasons that we are requiring this. The first is it's mandated right now. St. Joe Health Department has mandated that in a indoor facility that is access to the public, that they wear face masks to prevent spread. And so that will be through July 4th as of right now. And so that's the main reason that we're doing this. The second one is actually there is a study done recently, released as a result of COVID, that it discussed and studied the distance of respiratory droplets during exercise. And I think this one's pretty important because what it showed is that essentially if you are exercising without a mask on, the required social distancing that we are currently doing actually doubles. And so we're looking at a 12-foot radius as opposed to a 6-foot radius around each person in the gym if we're doing that, which means, unfortunately, if we had to do that, we would really be minimizing the amount of people allowed in the gym at a time. And so we want to make sure that we can get as many people in as possible and still maintain that 6-foot social distance. And the only way to do that with this study is to keep a mask on. So it's not fun, but it's going to be something I think is important. I also wanted to add that as a result of those masks, we are recommending that, there can be some psychological changes that occur wearing a mask and exercising. And these are things that we're aware of. So we recommend that people who have anxiety issues and things like that maybe should avoid the gym at this time as a result of that. We do know from multiple studies that have been done on this that thermoregulation, your body's ability to get rid of heat, really isn't changed a whole lot by wearing masks. So it's something that we know from a psychological standpoint can be difficult. And if that's something that you're worried about, we recommend right now that you don't come to the gym.
Thank you for these reminders because, the safety of our members, patients, staff, families, community really is our top priority at
Absolutely.
Beacon.
Absolutely.
So it's an ever-evolving situation. So I will end by asking you could or should we expect to see additional changes?
Oh, absolutely. I mean, I think as with anything that's been happening with COVID, I think it's important that all of our members check daily on their emails for status updates. As of right now, we have that July 4th date for the masks, for example, but this could change. We don't know that for a fact. And I think as we continue to watch what happens as we further open the community up, if we're seeing good results and less surge than we would expect, then these things might change. So I absolutely think people should stay on top of it and keep abreast of the situation.
Dr. Messmer, thank you so much for all this information. Look forward to speaking to you again as things open up.
Sure. All right. Thank you.
Thank you.